This is Dr. Cherise Flanagan. In today's segment, we'll be talking about types of validity. First of all, validity is the most fundamental and important characteristic of a test. It has to do with whether the test is measuring what it claims to measure. If it does, then scores have meaning. For example, if a depression test is actually measuring whether someone has depression, then that's validity. So how do you do this? Unfortunately, we can't sum it up in one little statistic like we can with reliability. It's not quantitative typically. Instead, we talk about it on a continuum from weak to strong, with acceptable somewhere in the middle. There are several types of validity that I'll talk about today. Three main types and several subtypes within them. Unfortunately, lots of them start with a C, and so they're hard to differentiate between them. So let's get started. Content validity is the degree to which items on a test are representative of the behavior or content the test was designed to sample. In academia, that means that whether a professor's test reflects what they said would be on the test, what was in the book, the content of lectures, etc., that's content validity. And so when students complain that they didn't know that was going to be on the test or they'd never seen that before, that would be a complaint about content validity. In clinical settings, it has to do with symptom correspondence. So whether or not that test of depression actually asks questions about sadness, loss of appetite, loss of interest in pleasurable things, and so forth. So how do we measure content validity? Well, we just examine that content very closely to make sure that it's an accurate sample of what we want to test. One way to do it is to use expert raters. So I could go to experts in the field of a specific area and ask them to for some inter-rater ratings of those things. But generally speaking, the researcher, the academician, the professor, we give close attention to content validity as the test is developed. The second type is criterion-related validity. Within that, there are two types, concurrent and predictive. Criterion-related validity is demonstrated when a test is shown to be effective at predicting or estimating an examinee's performance on an outcome measure. What that means is, does the SAT or the ACT, is it really successful in predicting what we want it to predict, which is college success, like GPA? That would be our criterion. At ACU, we might wonder, does chapel attendance predict religiosity, with religiosity being the criterion? If it does, then we have good criterion-related validity, although I bet there's some debate about that. Concurrent validity is when the criterion measures are obtained at approximately the same time as the test scores. You've heard me talk about batteries of tests. We typically assess someone all at the same time, within the same day, the same week, and that is the way we are working towards concurrent validity of a diagnosis. With achievement tests, there are subtests that we do all at the same time, same with IQ, and that's giving us some concurrent validity. We can also use an inventory, such as the Beck Depression Inventory, alongside of a self-report questionnaire of depression established by a psychologist. We can use those at the same time, and if they're both pointing towards depression, then we have concurrent validity. So it has to do is when we are looking at those things. Predictive validity, what we do with that is we give a test to applicants. You often see this in industrial organizational psychology. So we might give a test to applicants that we want to work for us. And then what we will do is in 6 months, we can compare those scores to the supervisor's ratings. And in that way, we can see, did high scores predict high supervisor ratings? In other words, did they make a good employee? Conversely, did low scores on that test predict low ratings? we want to know that the instruments that we are using have some sort of purpose, in this case, predictive validity. So what makes a good criterion? We do want to make sure that we avoid restriction of range problems. We see this in graduate school when everybody needs to make an A or a B to go on. So there's a restricted range in that. We also want to avoid criterion contamination, which is the type of thing that occurs when raters have knowledge of a test scores for those they are rating, like teachers, if they know that their students are gifted or they know that they have really high IQs, they'll expect more of them than and they'll rate them higher, actually, on objective measures. Just that information seems to bias them. The third type of validity is construct validity. This is the most difficult to understand, to really explain. A construct is a theoretical, intangible trait, and so this is like building a theory for validity. We have to do it piece by piece. We build it over time. We pull in information about reliability and about validity. Other types of validity, like content validity and criterion validity, may go towards the construct validity. So how do we go about measuring construct validity? Typically, we will correlate it with other tests that measure a similar construct. You don't want the coefficient to be too high, or you're measuring pretty much the same thing. You can also measure it against a test that should be completely different. It should be something independent or almost opposite from your test. And there is a sophisticated way to do that. We're not going to talk about it now, called the multi-trait, multi-method matrix. However, convergent validity is a type of this construct validity. This is when you're measuring constructs that really should be related to each other. Those correlations should be high. For example, two tests of depression. We could have one over here, the Beck Depression Inventory. It's a rather small scale. And then we could look at the subscale of the MMPI, the one on depression. And they should be similar. Not the same, but similar. And if they're both scoring high, then we're getting convergent validity. Discriminant validity is when we're measuring that construct that theoretically should not be related to each other. In fact, that relationship should be opposite. And so, in the example before, you could have a test of depression and then one testing life satisfaction. They shouldn't correlate. They should be different. And that's discriminant validity. Uh-oh. Here's one more type of validity that we didn't mention to begin with. Now, I separate this because it's a little bit of a different animal. Face validity is simply when a test appears to be valid. It makes intuitive or common sense, meaning that when you look at it, it seems to be measuring what it says it's measuring. And that's really helpful in diagnosis when you have a patient come into your office and they want to know, do they have ADHD? And you're giving them scales that reflect impulsivity and inattention and concentration problems. If you gave them a smelling test and said that it measures integrity, that would not be good face validity. But a depression test asking about sadness, then yes, that is good face validity. I'm going to move on to a few review questions. Remember, you can stop your audio if you want to think about the answer. I'll wait about 10 seconds between each question.